Well, promising news in the fight against the coronavirus. For the first time, British researchers say a drug has been shown to have an effect on death rates of COVID-19, cutting them by a third. We're joined by Dr. Stephen O'Day, who is the executive director of the John Wayne Cancer Institute at Providence St. John's Health Center. Doctor, thank you for being with us.
It's my pleasure, Michael.
All right, let's talk about it here. Dexamethasone is a steroid used to treat conditions from what? Altitude sickness to eye inflammation. So how does it work on coronavirus?
Yeah, so in this remarkable study that just came out this morning from Great Britain, this was a large controlled study showing that relatively low doses of dexamethasone actually reduced mortality in a very severe cases of hospitalized COVID patients. So the important thing to note here is that this is in the inflammatory condition when the virus causes inflammation in the lungs in advanced patients on respirators or requiring oxygen. The use of steroids at relatively low doses remarkably reduce the mortality rate. So this is a really important study that we need to clearly see more data. We've just seen the top line data, but it's certainly exciting news.
You talk about the research is focused on treating the most severe cases. So let's talk about the dangers of treating people who don't fit this particular category.
That's a really important point because steroids in viral infections, particularly early on in the infections, can make the virus worse and allow it to progress. So the data here clearly is not indicated as a preventative or in even early stages of disease where your T cells are very important factors in combating the virus. These are immune T cells, and steroids suppress T cells. In later onset of the infection with the inflammation in the lungs, that's a different story. And anti-inflammatories like steroids appear in this study to reduce mortality. Again, we need to see this study in more detail, but this is clearly a different stage of the disease than early viral infection.
Independent experts still need to weigh in. The results still need to be published. Yet Dr. Anthony Fauci says bottom line is good news. So are you finding the results as promising? And is this something we should all be excited about?
Yes, absolutely. We build an arsenal of tools to combat this virus. We've learned an extraordinary amount in roughly 3 months in the U.S. about how this virus works. And we now have the first antiviral, Gilead's remdesivir, for hospitalized sick patients. Now we have a second approach that works on inflammation, not the virus directly. These are two important tools that are going to lead to decrease, hopefully, mortality and lead us to even more. And science is prevailing. We need to be excited about this data.
All right, before we let you go here, any professional words of caution for the people who hear this news and are determined to run out, stock up on the steroid? What do you want to tell them?
Just know that this medicine has serious side effects and actually could promote the virus early in the infection. So it's the last thing we should be doing is asking our doctors for it or using it as preventative. Absolutely not. This is a very specific indication in very sick patients and needs to be determined by ICU and hospital doctors managing COVID patients.
All right, Dr. Stephen O'Day, appreciate your time this afternoon and your expertise, and thanks for being with us.
My pleasure.